Good morning, Dr. Ross.
Good morning.
You have been a chiropractor since 1983 here in San Juan Capistrano, and you are the creator of the Body Best Doctor method.
Yes.
When people come here to see you, they often come because they have a backache or a neck ache, correct?
Correct.
They think of chiropractor when they have a backache, but I have seen people coming in with all kind of different issue, for example, anxiety and sleep problem and depression, and they come in all depressed. You do your magic, and they come out like a different person. So chiropractic is much more than fixing the back or the neck, correct?
The nervous system, the brain and spinal cord controls everything, and that's what we fix. And I find the problem and then correct it. No matter what it is, whether it's a neck pain, whether it's they're not sleeping good, like you said, they're depressed. That's due. There's pressure on the nervous system. It's very delicate. That's why we have the skull protecting the brain, and we have the spinal cord protecting the spinal column.
And how does an adjustment do? Like just one adjustment, people have been suffering for years, and then in one adjustment suddenly, and seeing the other doctor, and there's no result, and they come to you, and you change their life in one session. That's absolutely amazing.
What we do different is we measure them on what's called the SAM, stands for Spinal Analysis Machine, and it's a postural analysis machine to see if they're balanced or if they are out of balance. So once I know how far out of balance they are, or if they're in balance, then I know what to do to correct it. And after I correct it, we put them back on the scales because they say, I feel better already. I says, let's check you on the balance scales, and then they're so surprised when they're now balanced. No pain. They feel wonderful because their nervous system that does everything is now working like it should.
And I have seen that in person, on and on, people coming in so badly, even like in a rolling wheeling chair, and coming out without the wheeling chair. And it's your revolutionary method that you have created over the 39 years of practice is absolutely amazing. So we want to share, to other doctors and patients that they can be well and they can feel the best of their life, going through Body Best Doctor and having a wonderful life that they deserve and the freedom. I have seen also, we talk about depression, anxiety, also sleep problem. How does the sleep and anxiety, you talk about the different hormone. What does that do when you do an adjustment? What happens to the hormone?
The two hormones that control our emotions is serotonin, which is during the day and when we're awake, and then the melatonin is the hormone that turns on when we lay down and our body slows down and goes to sleep. When they get injured or they have stress problems, physical stress problems, then that serotonin, melatonin teeter-totter balance isn't working. And so I have to find out why in the nervous system, in the body, why it's not working, and then fix it, and then instantly the patient feels better.
So after a chiropractic adjustment, people will be happier and sleep better, sleep deeper. And another thing I want to mention also is when people have dental work, braces or cleaning, they often come back to the chiropractor and are out of balance. Can you explain how that happened and how you can fix them?
Yes, good question. The jaw, we have the lower jaw called the mandible and the maxilla, and they come together and they're supposed to be the same. What happens when it gets out of balance, it affects what we call the jaw joint here in the cheek on each side, which dictates into the ear and the balance. So then when they're out of balance, the hormones shut down. When we put them back in balance, the jaw's balanced and on the scales balanced, then their nervous system's working perfectly and everything turns back on. The jaw pain's gone, the neck pain's gone, the depression's gone instantly.
So something to keep in mind for patients who goes get a cleaning and have braces is every time that they do those procedures, their jaw gets stressed and then out of balance. So that's important to get a chiropractic adjustment after those procedures, correct?
Orthodontics and chiropractic should work hand in hand.
Thank you, Dr. Ross.
You're welcome.